morning everyone. On the behalf of Degree College of Physical Education, Department of Yoga, I extend very warm welcome to all of you present here on Common Yoga Protocol Training course. I am pleased to share the distinguished guest to honor us with his presence today as chief guest is his presence. He is none other than Dr. S.P. Patil sir. I would like to call Dr. Labde sir. Please welcome our today's chief guest.
Thank you.
Thank you, sir. Our guest of honor doesn't require any formal introduction. He is a very respectable personality, but still in short, Dr. S.D. Patil sir, born on 28 August 1962. His academic qualification as sir completed his BP from Degree College of Physical Education in 1987. MPH in 1989, BY from GS College of Yoga and Cultural Synthesis, Kevalyadham, Lonavala in 1990. ND from AINCF, New Delhi, 1995. PhD in 2011. His topic of research is effect of yoga practices on selected physiological parameters, musculoskeletal thickness and body composition from Sant Garge Baba University, Amravati. Sir having 31 years of teaching experience. Member of many board associations, many committees and also awardee of Ambadas Vaidya Smriti Gaurav Praskar in 2002. Game of Yoga in 2010. Sir organizing many naturopathy and yoga camps, published paper in journal as the effect of yogic practices on cardiopulmonary efficiency of school girls, Vyayam Prasarak. And sir also as a life member of Akhil Bharatiya Prakritik Chikitsa Parishad, New Delhi, life member of Shree Hanuman Vyayam Prasarak Mandal, Amravati, life member of Indian Association of Physics Teacher, Kanpur, life member of Yoga Association of India, New Delhi. There is lot to tell, but time doesn't allow. I would like to request everyone to kindly cooperate with us throughout the program to make it successful. I would like to request our chief guest, Dr. S.D. Patil sir, to enlighten the audience with your precious words and demonstration with the help of a student of yoga department. Sir, please continue.
Thank you. Really, it's a very pleasant morning. Pleasant morning. Today we are going to learn some purificatory processes. Generally in yoga they are termed as Shatkrama. Here Shat means 6, Karma means action or the activity or processes. There are 6 kinds of processes in yoga. Just like in Ayurveda there is a Panchakarma. There are 5 processes, but here in yoga, there are Shatkarmas. Niti, Dhoti, Basti, Tratak, Navli, Kapalabhati, Shaitani, Shatkarmani. The verse goes like this. So here in this demonstration come explanation session, I am very glad that my students are here to demonstrate us different types of Shatkarmas, especially mentioned in Dharendra Sanhita. Dharendra Sanhita is the only text having more than 100 yogic practices and near about 21 Shatkarma. Now here, when we talk about Shatkarma, we must aware that these karmas are not only helpful for us to cleanse the body, but it also help us to have a calm mind and we can progress in the field of pranayama. As per traditional texts are concerned, it is said that after practicing asanas, one should do Shatkarma so that if there is an excess of fat, or mucus, or biles, or even there is a disturbance of three humours, one should practice the Shatkarma. So, in the path of yoga, Shatkarma have most important place. But nowadays, in yoga therapy, these Shatkarmas are very much helpful because their implications, when we apply it in a day-to-day situation, we can have good immune system, we can also develop resistance towards disease, and not only that, we can also, with the help of this Shatkarma, we can cure several diseases. Now, when I am saying to cure several diseases, it means that if you perform it regularly, you will not suffer from that disease. That is what cure means, not that just taking medicine and you are all right. So you have to practice your whole life because yoga is a way of life. So we must know that whenever you are practicing Shatkarma, we should aware that it should be practiced frequently as needed. If it is needed, it should be practiced regularly or with the expert guidance. You should learn first and then you can practice at home at regular interval. Now, when we talk about therapeutic value, nowadays, after this COVID-19, the post-COVID-19 period, the oral cavity, you have to keep the hygiene of our oral cavity, and for that, in Shatkarma, especially in Garindra Sanhita, it is said that there are three types of dhoti, that is Danta Dhoti, then Anta Dhoti and Hrida Dhoti. So here, when we talk about Danta Dhoti, so there are four kinds. The first one, that is Danta Moola Dhoti. Now here, Danta Moola Dhoti, it is so simple, but we must understand that the health of our teeth is depend on the gum, and that's why in yogic practices it is said that this Danta Moola Dhoti helpful to keep the health of your teeth very well, and always it help us to maintain our teeth throughout the life. Now here my student is demonstrating how to perform this Danta Moola Dhoti. Just you have to use your thumb and index finger and you have to give massage to your gums, upward and downward also. Both the gums, lower gums and upper gums, should be practiced very efficiently with the help of water only. Simple plain water you have to use for massage, and this will help you to keep the health of your gums and the teeth. Now the second dhoti, that is Jivha Moola Dhoti. She will demonstrate Jivha Moola also. So Jivha means the tongue. Here you have to take your three fingers, place it near your throat inside and give gentle massage to your tongue up and down, inward and outward, and give this massage gently, and this should be practiced after any meal or anything. If you drink or eat, you have to practice this so that the phlegm, the cough can be reduced very nicely. Okay, stop practice. This is Jivha Moola Dhoti. Now the Kapalabhati Dhoti. Now there are two methods of Kapalabhati Dhoti. The Kapal, the upper hard and soft palate, you have to clean through the help of your thumb. You please see that the girl is demonstrating just the help of the thumb. You have to give massage to your hard and soft palate, even up to the throat. You have to insert your thumb and give massage, gentle massage to it. So this is very good practice. Generally, to day-to-day life, we are doing the brushing of our teeth, but we forget to clean the soft and hard palate. So it is one of the best practice that you should do every day. Now, the second variety of it, just keep your middle finger at the tip of in between your eyebrow, just above it, and just rotate it clockwise and anti-clockwise 10 times at least. So this is also practice, some yoga institutions practice that. This is also known as Kapalabhati Dhoti. Now this practice also help to awaken your Kundalini Shakti at the level of Agya Chakra. So this Agya Chakra and Kapala Shuddhi. So in Kapalabhati also there is a Kapal Shuddhi, but that is from inside. Now here you have to just rotate it clockwise and anti-clockwise also. Ulta bhi ghumaiye. So this is very simple practice, one should practice every day. Now the next portion, that is our ear. How to cleanse our ear? It's a very simple one. We must keep in mind that we should not insert anything in our ear to clean. Just use your index finger and place it in just slightly. Don't press it. Just keep it there at the Karna Randra. Randra means hole. The hole of your ear, and just slowly move your hands just like screwdriver. We are giving movement to the screw. So that way you can do it. And there is another variety of it, that you have to move the fingers in a clockwise and anti-clockwise hole. The next दूसरी प्रकार केवल उंगली घुमाना. Yeah, very nice. Here she is demonstrating that Kapala Randra, then this Karna Randra Dhoti. This is very good practice. Every day you should practice when you wake up and before you go to sleep. It is very beautiful practice. There is no restriction of this practice, but its effect should be smoothing one. You should feel delight after practicing this. Don't press your fingers inward. Just place it there and move it slowly, giving gentle massage to your ear. Very nice. These kriyas are very much helpful to keep the health of your ear, your oral cavity, your throat. Now we will see how to clean. Just stop practice. How to clean our nostrils. So there are different methods of cleansing of nostrils. First, that you have to blow your nose one by one. You can keep your right thumb on your right nostril and inhale. Exhale forcefully. Ten times, and you have to repeat the same with the another nostril 10 times. So this can be performed in standing position, bent position also, in squatting position also, with the deep breath and then exhalation. So blowing of the nostril is the simplest method to clean our nostril with the help of air. So you have to use our breath to clean our nostrils. So simple one. Now with both the nostrils, just inhale, दोनों हाथ घुटने पर, so both the nostril 10 times. So जब भी हम इस, whenever you are practicing this, you have to do it 10 times. And with bending position, just stand erect, सीधे खड़ी हो जाइए, bend forward 90 degree, कमर से आगे झुकिए, bend from your waist. Now do the same thing with the abdominal movement. Inhale and exhale forcefully. Inhale and exhale. Don't raise your head, don't move your head, just move your abdomen. Very good. After this kriya, we have to practice Jal Neti. Now this Jal Neti, you have to use a neti pot. इसे नेति लोटा भी कहते हैं. इसमें एक स्प्राउट, एक आगे नोजल आता है, that you have to fix in one nostril and the water will flow with the other. You have to keep your mouth open throughout the practice. Inhale through your mouth. Keep your mouth open. Relax yourself. There should be a pleasing sensation from within. feel the flow of water flowing from your one nostril to the other. Just relax yourself. Stop practice. Stop practice. रुक जाइए. Now here what happened? She is swallowing action is doing. That's why some water is going inside the stomach. To avoid that, you should relax. Everyone who is practicing this Jalaneti should relax. Take your own time. Do it with another nostril. From that side, just relax. Keep your mouth open. Here, don't tilt your head up to 90 degree because there is a chance that the water will flow into the auditory tube. To avoid that, you should keep your head 45 degree tilted, not more than that. Very good. Just stop practice. The water should flow from the nose, not from the cheek. Relax. So this is Jalaneti. It is very good exercise. Shatkarma or one of the karma of Neti. So here this Neti Kriya also helps to clean our nasal passage. After that, again you have to do the same thing, blowing of the nostrils with one nose first, then another nose, then both then and in bending position also 90 degree. That was demonstrated previously. Now she is going to perform in front of you Sutra Neti. Now there is another method, Sutra Neti. Generally it is practiced with one catheter. Nowadays we are using this catheter, but in our text it is said Sutra means it is a cotton thread, that you have to use the cotton thread with the wax, beads wax. You have to thicken it and then you have to push it through the nose and take it from your mouth, and this particular thing is known as Sutra Neti. Now she is performing with both the nostril simultaneously with smiling face. She is enjoying it. So this gentle massage is very much important to keep the hygiene of your throat, nose and oral cavity. So this Sutra Neti, not only that, it also stimulates your right and left brain. So both hemisphere there is a balance. So you have to take it out through your mouth. This is Sutra Neti. Very nicely she demonstrated. Now you have to again do the Jalaneti, then blowing of the nostril and then Udiyan Bandh. So in Ayurveda there are Purva Karma and Paschat Karma. So here Purva Karma you have to blow the nostril in past. After the karma is over you have to do again the same thing. Now after this Jalaneti, Sutra Neti, we can perform Jala Kapalabhati. Now this Jala Kapalabhati, that is, she is going to demonstrate it. You have to swallow some water inside your mouth, suck it and then throw it through your nostril. So this is one of the best kriya without any instrument. Just you have to drink water and you have to throw water through your nostril. The technique is very simple, but you have to practice it. Under expert guidance that will be better. Sometimes people are very much straining themselves to practice this. So that is not good. Just do it very easily. Just you have to take a mouthful of water and then create the pressure inside your oral cavity and do swallowing action, half swallowing action. When water rushes to the throat, you have to exhale the breath from the nostril so that the water will come out through the nose. So this is Jala Kapalabhati. Now there is another variety also. You have to take water through the nose and you have to throw it from the mouth. If it is possible to demonstrate, you can नाक से निकाल कर मुंह से लेना. So you can sit down in Tadasana. आराम से. Take your own time. So this is very simple. Again the same thing, but you have to do it in a reverse way. You have to take water in your hand or you have to use the glass in front of your nose and just touch it above your upper lip and try to suck the water through the nose. Keep your mouth open and throw it through the mouth. Okay, let us try. Yeah. So this is also Kapalabhati. There are 3 types of Kapalabhati as per Gharanda Samhita is concerned. Okay, stop practice. Kapalabhati is concerned, that is Vata Kapalabhati, that generally all of us we know that just contraction of the lower abdomen, and at the same time you have to exhale forcefully. The inhalation is passive. Stroke should be gentle. Some people, they are doing it very roughly and wrongly. This is not Kapalabhati, this is hyperventilation, inhalation with force and exhalation with force. It is not good. Now, after this, this Danta Dhoti, now we will move towards the Rudra Dhoti. Now, in Rudra Dhoti, there is a Kriya that is known as Ganda Dhoti. Previously, it is performed with banana stem of the, and that you have to swallow and you have to throw it out, so that there should be a cleansing of your esophagus and stomach. Now here, with the help of rubber tube, they are performing Danda Dhoti. They have already drink water, just 2 or 3 glass of water, and then you have to swallow the tube, and slowly, when you are swallowing it, when it touches to your glottis, generally there is a vomiting sensation. To control that, that is the most beautiful thing in yoga. You have to control it and try to swallow the tube as you are swallowing the food, and then just relax. Yeah, it is enough. It will come automatically. Just relax yourself. Push your Danda Dhoti inward, outward, and water will come. So this is Danda Dhoti. Very good practice. But if you are not able to do that, there is no need to perform it. You will get the same benefit with Jala Kapalabhati. Jala Kapalabhati, Vamana Dhoti. Vamana Dhoti, it is a very simple technique. You have to drink near about 6 glass of water, and then you have to throw it out through your mouth. So drinking of water should be in Kagasana. You repeat. Drinking of water in Kagasana, especially it is mentioned in yogic texts, when you are drinking water, you should sit in Kagasana. So, or you can see in Bajrang Baitak also, whatever he has adopted, Bajrang Baitak, Kagasana, that you have to sit on your heels completely. Yeah. So, you have to drink water as fast as you can. Jitna जल्दी आप पानी पी सकते हो उतना. 6 glass of water or 3 mugs, that is what you have. If you drink it up to the throat, then whenever you lean forward, it will come naturally out through your mouth. So here, Vamana Dhoti, it can perform every day. There is no harm in it, but you have to learn it with expert guidance, because all these Shatkarmas are very useful, but at the same time, if it is done, performed wrongly, it may give bad effects also. Generally, there is a belief that yoga don't have any side effect, but if it perform wrongly, even asana or pranayama or shatkarma, it is not good. Now, come forward. Just slowly, you can insert your index finger, press your tongue at the bottom, and the water will come naturally out. Just relax yourself. Do it again. Okay, you can drink more water. And that's why it is said in Hatha Pradipika that kantha means up to throat. You have to drink water up to throat. When your stomach is full, generally, natural reflex is that you will omit whatever there in the stomach. And that's why this is also one of the good Shatkarma, Vamana Dhoti. Like this, there is a Gajkarni, where voluntarily you have to throw the water out. There is a Baghi Kriya also, where after a meal, you have to throw your undigested food out after 3 hours of meal. Just relax. It will come. Relax. Botani dabun thev. Just press it there. Yeah, press it there. Place it there. We can wash your hand afterwards. Yeah, just place it there. Don't sound we make. Very good, very good. It will come in. It will come. Just you relax yourself. Yes, yes, that's it. So this is Vamana Dhoti. Sometimes people feel very bad now. There is a in when you go to the villages, there are some old people. They are practicing this with the sound. So this sound is unnecessary. There is no need of sound. So we must understand. Okay, just relax. This is Vamana Dhoti. What he is performed with the help of fingers. You have to press your index and middle finger at the bottom of the tongue. Now Vastra Dhoti. Vastra Dhoti, it is also a part of Rudra Dhoti, is strengthen your heart. Generally Rudra Dhoti, when I was giving a lecture at MDNY regarding the Shatkrama, at that time I told Shodhan Karma, that time I told that this Vastra, you start Vastra Dhoti, there is a cloth, cotton cloth, well stitched from all the four sides, and it should be swallowed just like you are drinking or swallowing something. Just imitate swallowing action, it will go. It should always, you have to swallow with wet, with water, or even you can swallow with milk or buttermilk also. So this Vastra Dhoti, cleansing of the stomach and esophagus very nicely. So this Vastra Dhoti is very important Shatkarma of our yogic literature. Generally, it is not practiced in most of the institutions, but Hanuman Vyayam Prasarak Mandal are very much interested to propagate this Shatkarma. Now, up till now, near about 50,000 students from different part of our country. In Degree College of Physical Education, we have students from 25 states of the India, and all of them are learning and practicing this Vastra Dhoti. Even in the field of physical education, other courses also, they have been taught these Shatkarmas very well, so that they can maintain their health throughout their life. So this Vastra Dhoti, you have to drink little water. If there is a problem in your throat, you feel suffocated. Sometimes when students start to learn this, they feel that there is a choke of their breath, but it is just feeling. There is a no such thing happened in 31 years of my experience that somebody is fall collapse or have some problem due to Vastra Dhoti. But there is a misconception about this. If you perform it, it may cut your esophagus, it may cut your throat, it may injure your inner organs. Now here, after swallowing it, you have to perform Navli Kriya, or move your abdomen forward, rotate your abdomen, Navli Kriya. Just no need to show. Okay, you can show. So this Navli Kriya after Vastra Dhoti is most important, because just like in our washing machine, we put the cloth in it which are dirty and the dirt is moved out. So here what we are doing, we are taking clean cloth in, the whatever the impurities are there on the walls of the abdomen, just go side, just slowly, very good. And you have to remove it through mouth and relax yourself. If you find it is difficult, just relax, take a deep breath, or you can sip of water, you can drink a water, and then again you have to try. Sometimes it's happened that students think that no, it will not coming out, and they try to force it. Straining of anything in yoga is injurious, so you should avoid the straining. So here now he performed Ganda Dhoti, Vastra Dhoti, Vamana Dhoti. The same way we have to perform the masterpiece of this yoga, that is Navli Kriya. Now this Navli Kriya, before learning it, you have to practice Udyan Bandh. Before Udyan Bandh, you have to practice Bahya Kumbhak. You have to retain your breath outside for at least 10 to 20 seconds. Then and then you can perform the Navli Kriya. Now just exhale completely, hold your breath outside and relax yourself. The first step, that is most important. close your nostril with the help of your fingers and raise your chest. Relax. So this particular practice is very useful for Navli Kriya. So this is Udyan Bandh. So without Udyan Bandha you are not able to perform the Navli Kriya. So first you have to learn Udyan Bandha. Now how to learn Udyan Bandha, that should be also practiced, because it is a practical session. So I ask my student to just exhale completely and hold the breath outside without expanding your chest. Keep your nostril closed with the help of fingers. Don't raise your chest. See, he is habituated with the raising of the chest, that's why the inverted V is there. But when a layman practices this, his abdomen will not move inward. So he has to exhale and hold the breath outside, practice it for few days, then relax, relax. Then you have to exhale completely, hold the breath outside, close the nostrils, and then expand his chest, and then lift his stomach and ambivalus towards the back and upward. Now do the Udyan Bandha complete process. Exhaling completely, hold the breath outside, apply Jalandhar Bandha, touch your chin to your jugular notch and expand your chest, lift your ambivalus. अपने नाभि को पीछे की तरफ खींचो. Very good. So this is Udyan Bandha. Relax. Now, before starting Navli, one should practice Agni Sar. Agni Sar या Vahini Sar. Agni Sar here, Agni means Jatharagni. In Ayurveda there are 13 types of Agni. So Jatharagni is one of it, that digestive fire. So you have to increase the movement of your abdomen, you have to control the muscles of your abdomen, move it inward and outward forcefully. Push it forward and take it inward. This is Agni Sar. There are different variations of Agni Sar. This is one of it. And without breath holding also you can do that Agni Sar Kriya. So this Agni Sar help for your Navli. Now before starting Navli in sitting position, one must learn it in the standing position. Just be in hopscotch position, both hands on your knees. Now exhale completely, hold your breath outside, do the Udyan Bandha. Now here, after performing Udyan Bandha, you have to contract your recti abdominal muscle, push it forward, center, that is Madhya Navli. See, the middle part will come out. So you have to practice it again and again. Just Madhya Navli. See, the both sides are gone inside and middle part come out. So that is Madhya Navli. Just relax. So you have to practice this for few days. Then you have to do the Vama Navli. So here Vama means left. You have to give pressure on your left thigh, left knee, so that it will move to the left. So this is again inhale, relax. Do it again, Vama Navli, warm side. Very good. So here there is a pelvic movement, but it should not be there. You have to contract the left side muscles, recti abdominal muscles. Relax. Now the right, Dakshina Navli, right side, you have to exhale, hold the breath outside, then Udyan Bandha, and then the right side should be contracted. So this is Dakshina Navli. Now relax. Now you have to start with Madhya Navli, then right, then Udyan, then Vama Navli and Madhya Navli. So it will move in a circular way. That is Navli Chalana Kriya. Just do it. So he is doing it forcefully and again with the speed. So you can go, whenever you are learning, you should practice slowly Madhya Navli, Dakshin Navli, Udyan Bandha, Vama Navli and Madhya Navli. And then reverse, just relax. Then you have to perform it anti-clockwise. Vama Navli, Udyan Bandha, Dakshina Navli and Madhya Navli. So in a reverse fashion also you have to rotate your recti abdominal muscles, that is known as Navli. And this is the masterpiece. It is said, just your abdomen, there will be no problem in your abdominal organs. So this is one of the best thing that we should learn from a competent guru or yoga teacher. So here, be seated. Can you perform in sitting? Navli? Now, for advanced sadhakas, it should be performed in a Padmasana, and you have to move your abdomen in a forward, first Madhya Navli, and then rotate it. Instead of rotating your shoulder, concentrate on your abdominal muscles. Just relax, relax, relax. In one round, you have to practice 10 rotation, and in second round, anti-clockwise 10 rotation for beginners. But afterwards, you can go towards 25 rotations in one. Now anti-clockwise if you can. Okay. So practice makes things easy. Now I have changed the proverb. Generally, I have been taught in school, and you may probably you also, that practice makes things perfect. But the second thing is that nothing is perfect, nobody is perfect. Then how practice makes the things perfect? So I change this proverb. I say practice makes things easy. So you have to practice it so that it can happen. Yoga should not be performed, it should happen. So in asanas, in Shatkrama also, it is most important thing. Now there are different yogic Shatkarmas that we are not going to demonstrate here, but just I will give brief introduction. Tratak. Let him do. Just relax. Now there is a Tratak Kiya. There are different ways of performing Tratak. Some we can say that there are two types of Tratak, Samip and Sudur. Samip means the near one, and Sudur means a long distance, or indoor Tratak and outdoor Tratak. Outdoor Tratak, generally it is performed in the morning or the evening, okay, rising and sunset, at the sunrise or sunset, when you are standing on a building and you have to concentrate there. Or you can have a tree, a long distance tree, you can concentrate. So this is not the purification of eye, it develop your concentration for better concentration, because Tratak, it is the step of going from Hatha Yoga to Raj Yoga. Here you move towards your mind. That is the beauty of Trataka. Trataka, although it is concerned with the eye, but there is no improvement of eyesight as per research is concerned. There are a lot of research performed in different yoga institutions, especially in Yash Vyasa of Bangalore. They found that by performing Trataka, Jalaneti, Sutraneti, there is no improvement in eyesight. But still, yoga teachers used to say, if you perform Jalaneti, Sutraneti, Trataka Kriya and yogic practices, your eyesight will be good and you can remove your spec. But generally, it is not so. But as it keeps your health of the eye and the oral cavity, the skull cavity, the chest cavity and abdominal cavity in a good condition. If there is a perfect alignment of these all things, so naturally all the organs, all the delicate organs, they will work efficiently if there is a proper alignment. And this happened due to this Shatkarmas, and that's why this Shatkarmas should be practiced as per requirement. I will not say every day, because Vastra Dhoti should practice once in a week or in fortnight, in 15 days, or 2 times in a month or 4 times in a month, not more than that. But for beginners, when you are learning, so you have to practice it daily, so that there will be a resistance to your vomiting reflex. So here in yoga, what we are doing in Kunjala Kriya, we are stimulating vomiting reflex without the help of anything, just by mental thinking. I have to vomit, you have to contract your abdomen, at the same time you have to throw your tongue out and throw the whatever inside the stomach, that is Gach Karni. So voluntary vomiting you have to perform, that is Gach Karni. But in Ganda Dhoti and Vastra Dhoti we saw that when we swallow it, it is a natural process. That which is not able to digest, body will throw it out, and that's why we are not able to swallow it. Some people feel very hard. There was a patient in our Yoga Chikaldara camp. This camp we run every year from 11th May to 31st of May since 1977. There one old person near age about 80 years, he never omit in his life. So I asked him that you have to perform this Ganda Dhoti. He said, no sir, it is not possible because in whole my life I never perform it. But I insist that you should practice it. So he says, sir, no, it is not possible for me. So again, as all are practicing, he also feel that if sir is taking so much of interest in me, so I should perform. So he simply drink one glass of water and come in front of me. So see, it is not coming. So I asked him to have 2 glasses of water. Then he again went and come back after drinking half glass of water, because mentally he was set that there will be no vomiting to him. And a child, because in our Chikaldara camp, from 10 years of age to 80 or 90 years of old person can attain these yogic practices. So the child came, sir, इन्होंने 2 glass पानी नहीं पिया, only half glass of water he drink. Then I asked that old person, uncle, you have to sit here and drink water in front of me. 1 glass, 2 glass, 3 glass. No sir, it is. And at the 4th, when he swallowed the 4th half, and without anything he start vomiting. So that's why Kantha, you have to drink water more. So it is a natural reflex that which is more inside your body, it will be thrown by body naturally. So that woman is happened. But in Ganda Dhoti and Vastra Dhoti, there is a vomiting tendency. Now you have to suppress it. So that is the beauty of yoga. It train your autonomic nervous system. What is willpower? Willpower, it is nothing but control over the autonomic nervous system. So by practicing suppressing and stimulating vomiting reflex, you control your nervous system. So these practices are very helpful to control our emotions also. Generally, it is not expressed in our yogic text that to control emotions, emotional quotient nowadays, it is very important. We are very eager, instant ka zamana hai, everything we want the result, but emotional quotient is important, and by practicing this Shatkrama, emotional quotient can be increased. We can have good patience in us. So this Shatkrama, last but not least, that is Basti. Basti are of 2 types, that is Jala Basti and Sthala Basti. Sthala Basti is the air on the ground, Jala Basti in the water. So you have to suck water through your anus, keep it for some time and throw it out. Just like Vyayam Dhoti, we are taking water in, you have to suck water through your anus, hold it there and throw it out. There are different tubes that you have to use. Wooden stick is there, it is hollow from within, and then insert, you have to 1.5 inch inside your anus, and then sit in a water and perform Madhya Navli. When we perform Madhya Navli, there is a negative pressure and we can suck water or air inside our rectum or in large intestine. Even we can rotate it by performing Navli, the air you can move. So this Basti Kriya is very helpful. Even we can have this papita stem of the leaf that can be used to as a tube to insert inside the anus, and this is Basti Karma. Now last but not least, that is Shankha Prakshalana. This is one of the best thing every Indian can practice, but it should be learned under expert guidance. There are 5 asanas that you have to perform 10 times. That is Tadasana, Triyak Tadasana, then Bhujangasana, Triyak Bhujangasana, and Udara Akarshanasana. Can you demonstrate these asanas? So that will be better. I think time is over. Okay. Now these asanas you have to perform. We can have another session, practical session for Shatkrama, because it required near about half an hour to demonstrate this Shankha Prakshalana. Now Bihar School of Yoga is also very much keen interested to demonstrate this Lagu Shankha Prakshalan. In Shankha Prakshalan, you have to drink 2 glass of saline water, salt in it, and you have to swallow it 2 glass, then perform the asanas, then again 2 glass, again perform asanas, again 2 glass, 16 glass of water you have to take, and you have to perform at least 8 times. On all these 5 asanas, 10 times each. So it need vigor. Then and then it is possible. For a layman, the Lagu Shankha Prakshalan up to 6 glass, they are advocated that you should practice 3 glass of water and then perform these asanas, then again 2 glass of water, then perform these asanas, again 2 glass, and wait for the evacuation. It's naturally is there if it is okay, or don't strain to evacuate. In Shankha Prakshalana, it should be always kept in mind, you should not apply force. Even in day-to-day life, whenever there is a problem or constipation, don't apply any strain, any force to evacuate, because it disturbs your inner mechanism. So it is a natural process. You have to increase fiber food in your diet, so that your whole large intestine should be cleaned properly. There are other kriyas also, but due to lack of time, we will stop here. And here I will again repeat some few tips for practice. First thing, these all Shatkarmas should be practiced in empty stomach before your breakfast. The morning time is the best one. Second thing, if is there any problem, health problem, consult your doctor, your therapist, and then you have to learn these practices under expert guidance. Third, most important thing, the health, status of your health, age, even the sex during pregnancy. This Shatkarma should not be practiced except Jalaneti and Jala Kapalabhati. Other kriyas should not be practiced. So these precautions you have to keep in mind, and it is always said, Guru Updishta Margena, as advocated, as guided by the teacher, you have to practice these Shatkarmas. With these words, I take leave from you. Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat.
Thank you, sir. I extend a really hearty vote of thanks to our chief guest SD Patil sir, who spared time from his busiest schedule. Today we have an opportunity to hear your thoughts, and this will surely be going to encourage us in our future events. I would also thanks to people who worked behind the scene to make this event happen. With the permission of Head of Department, I announce that this program is over here with Shanti Part.
If you want to have a group of people, please come for Shanti Part. Come on, hurry. एक उधर से बैठो, एक इधर से बैठो, जल्दी.
वीर्यं करवावहे तेजस्विनावधीतमस्तु मा मृत्विषावहे. ॐ शान्ति शान्ति शान्तिः.
हरि ओम तत्सत, हरि ओम तत्सत, हरि ओम तत्सत, हरि ओम।